go ahead and do the turf toe. This is when someone has hyperextended their first metatarsal. So we're trying to help them by putting them in a slight flexed position so that they don't overstretch that toe again. And what you want to do is have your patient seated. They can have their leg extended, and they want to be with their pulling their foot back into what's called dorsiflexion. And you're going to do an anchor right across just below the metatarsals, right across the forefoot. So use your tape. You can use your 1.5 inch white tape. We can spray this with tape adhesive because that will help it stick to the bottom of the foot because the foot does sweat. And we can go across, just doing one circular to create the anchor. And this is going to be an important anchor because this is where all of your other strips will attach. So make sure you just smooth it out. Right now, I didn't spray it with tape adhesive, so it's not sticking as well. So you can see in real life, it is real life, but if it was a real patient going back to the field, we'd want to do the tape adherent. So what we'll do is we'll tear the 1.5 in half, and then there's usually one side that's a little bit wider and one side that's smaller. Since we're dealing with a toe, we want to go with the smaller side here, and we have a second anchor, and that anchor is going to be around the toe, and that's where your strips are going to go between those two anchors. So you can the best way you'd want to do it, you think you'd want to do it that way, but the better way to do it, one little trick, is to go in between. That way you don't have to spend your time trying to go between the toes. You started there, so you don't have as much difficulty with the mobility of taping. So you can see I have my anchor here and my anchor here, and it's a very small space. I have to create tension. I'm gonna go straight down, pulling the toe into a slightly flexed position. You're not trying to fully flex them. You want them to be able to move. If you do this, they won't even be able to walk. So we kind of want a slight flexed position, and then we can basically tear the tape in that slightly flexed position. You can even pre-tear your tape if that's not working well for you. So I was having a little bit of trouble, so I can just pre-tear it ahead of time, and then I can place it on. You just have to measure it out properly. So I'm going to go to the right side, just fanning it slightly, and I didn't measure it exactly right, so I'll have to tear it off a little bit, which is fine. But I can still see them in that slightly flexed position. I'm going to go ahead and go to the opposite side, do it again, start here, go down, measure, and tear, pulling here, laying down. Nice and easy. Okay. Then we'll do just a couple more. 3 should be sufficient, but if you're not comfortable with that 3, if you're not seeing the toe flex forward, then you can do more. So I'll just do a couple more just for demonstration. And we want to take our strip, pull them into slight flexion, and then tear it. If you're ever having trouble and it's coming off, just place your finger on one side, lift it off, pull, and lay it down, because it is a very small space and it gets a little tricky. I'm going to do one more strip. And I am fanning them. Once you get past the first 3, it's not really important how you fan them. It's just a matter of angling it differently so that the full toe is flexing. I can tell the toe's flexing, so I want to do my anchor with my 1.5 on the forefoot to anchor in all the strips I just did as I wrap it up. Make sure it's nice and smooth and attaching. And then what I can do is take my larger side of the tape and use this to cover up all of my strips. And just wrap that around as a circular. Make sure you lay it on pretty well and it sticks. And this will keep them from fully extending the toe. So go ahead and try to extend your toe back. And you can see there is still some extension, but it's limited by the support and it's restricted by this taping. So this would be for turf toe, and it's called the turf toe taping.